Okay, now listen now. See, these because of latest technologies and because of so much development in our medical system, we are having baby preterm and preterm by 28 weeks, 38 weeks. Woman is in labor, we are trying to get the baby alive. So it's been happening in past 30 to 40 years. Maybe because of our new development, or because of new diseases, and weak mothers, because of bad like food habits. Now there are lots of preterm children also. So now what they understood, like in preterm children, there are so many diseases they are risk into. First thing is nephrotic syndrome, or any renal system. So what happens here? Up to 2 million nephrons is there in each kidney. So it will never grow. When you are born with 2 million nephrons, that's it. Till you die, the 2 million nephrons only you will use, like little bit, little bit, little bit. Okay. So what happens in preterm child? She or he may have around 1 million or 500,000. So what happens? These children will be like soon they'll be prone to renal malfunction. Like this, even in heart, even in brain, so many things are happening. Even there are so much risk into cancers. Based on latest research over now, we understood all those things. Understood. So this preterm children is alone, it's a big big task. You can't just ignore that he's a preterm. Even for all the pediatrics, what they are saying is you have to know the preterm their gestation also, whether the child is preterm or term or postterm. So like that, it have been given more important. Why? Because of child, because of less development. Nephron is a functional unit of kidney. So what if you have less nephron, you are more prone to renal disease. So in India, we don't have Viva and all those things. In Sri Lanka, in ERPM exams, what they have is they have a Viva and physical exam also. They'll give you a baby and they'll ask you to tell whether it's preterm or postterm. Even in USMD also, in clinical skills also they will ask. So what happened in one case scenario, my friend who has passed in all the subjects, they gave baby in front of him, and they were asking, just tell me about this baby, like what happening to this baby, like the baby had faster respiratory rate, and the baby is he diagnosed it as a respiratory distress syndrome. He saw the clinical signs. I'm going to teach you that he diagnosed as respiratory distress syndrome. And what examiner asked him, just tell me whether this baby is boy or girl. He did not check that. He did not open the he did not open the panty, and he did not check that. He got fined. He told everything correctly, but he did not know whether the girl is boy or girl. Just like that, you can't say, it's a boy or girl. How you will differentiate in 1 day of child, 1 day or 3 days of child. Like that, like examinations are tough over, in many countries. Even our exams are also difficult ones. So again, term one, preterm children, you can't say immediately by, by just seeing the baby, you can't say whether it's preterm or term child. So in preterm child, what will be there, and term child, what will be there? We'll see that. Okay. So how will differentiate to term child and preterm child? I don't know. Next, they may include all those things also. Okay. So term child will be in flexion. The posture will be flexion, and it's a normal way. Child should be in flexed position. Why child should be in flexed position? Can someone tell me? Why? See, flexion variation is normal. Why the child is in flexion variation, and why it's so important? Just like that, we are not created. We are created for purpose, and each and everything, we are doing is just for a purpose. So this flexion variant of child, what purpose does it serve? Child is in flexion position. What purpose does it serve? Can someone tell me? Hmm. Okay, I'll give you a clue. What clue can I give? Okay. Preterm babies are more likely prone to dash. Two questions, same answer. Preterm child are more prone to what? Environment point of view. Don't go into deep on that. Just tell me on something. Huh? I can't get it. Cold. Who said cold? Good. Infection. It's all correct answer only. But what I am expecting is cold, hypothermia. The preterm child are more prone to hypothermia. Why? They are loose. They have less brown fat and all those things. And one of the causes is because they are in extension position. So flexion position will generate heat. Understood? That's the reason. That's what I'm trying to get from it. Flexion position will generate heat. Extension will not generate heat. So that's why that is also one of the reasons why preterm children are more prone to hypothermia. Doesn't mean that term children are they are vaccinated from hypothermia. Doesn't mean like that. Just comparing. That's it. We call this as scarf sign. What is scarf sign? Elbow doesn't cross midline. Elbow cross midline. Usually boys they hate pediatrics, because of child will keep on crying and all those things. Girls they like pediatrics and boys usually they don't take pediatrics because they are intolerant to all those cryings and all those dramas. So doesn't mean that you can skip pediatrics. Anyone will ask for pediatrics. Like your relations or your nephews or niece. Whenever any problem comes to child, immediately they'll run to pediatrics. Same if you are having a fever, you just take a medicine. Or your friends having fever, they'll take a medicine, they'll take Brufen like that, they'll go. But if child has fever, they'll run to the department like that. Pediatrics is very important because the way the parents these days they are very much attached to child and all those things. It's good as well as it's bad. So these things are not you have to know. You have to know so that you can show good opinion of yourself to others. Can't ignore. That's why I'm more oriented to clinical science. You have to know all these things. Understood? So scarf sign what? Elbow crosses the midline and elbow doesn't cross the midline. Understood? Breast bud. Breast bud is greater than 5 millimeter and lesser than 5 millimeter. All when child, child sleeps, we'll just take the elbow and we'll just keep it and we'll check whether it crosses the midline or not. There's a scarf thing, like scarf, like the scarf or like in salwar they have like that, right? Like that. You'll just cross it in the line. Even child, like in asymmetric tonic reflex, you learn that now. Child one leg will be extended, another leg will be flexion, and then child will be in this position. That's his scarf sign. When child is in this position, we'll check the elbow whether it crosses midline or not. That's it. Say, the definition itself says breast bud will be less than 5 millimeter for preterm and greater than 5 millimeter for term child. Mostly what you'll do all those things, you can't, immediately you can't say. Now I'll tell you two signs in which that you can see immediately, like this preterm or term child. No need to take, something and measure 5 millimeter or not. By experience, more than 10 or 20 years, you will know. Right now, we won't know all those things. Understand? So we'll check the genitalia. First thing, any child, any preterm infant or any infant you are going through, like in exam, like you may go to PLAB 2 or you may go anywhere. Nobody knows. Some will try to go abroad also. First thing you have to know is you have to check them. You have to check the genitalia. Whether you have boy or girl, you have to know that. Okay. For here, for male child, rugae is present. Rugae is folding to the scrotum. Okay. Rugae is present. In preterm child, absent. It will be like tiles, like it will be like tiles. No rugae, no depressions will be there on the scrotum. Okay. On male child. So testis is palpable. This is palpable. Yes. Usually not. Again, see, preterm is from 28 weeks to 34 weeks. 36 weeks. 34 to 36 weeks child will be more like term child only. Understood? So 34 to 36 weeks child may have a rugae may be there, or like a testis may be palpable. Understood? So the 34 to 36 week child will be more to term child only. That's why I'm saying usually. I'm not giving you definitely that it's absent like that. Understood? In female, labia majora covers labia minor. Okay, labia majora will cover over labia minora. But in see, look, okay, write it. Written. So labia majora is this my left hand covers over labia minora. But in preterm it will be equal or a little bit above. Okay, so equally visible. Equally visible. Next is the last one. Ear recoil. Okay, this is our recoil. You can recoil your ear. Our ears are like well recoiled in shape. But for a preterm child, it is not prominent. For term child, it's prominent. First thing you learn about. First thing what you will do. First thing you will notice the ear. Okay, suppose you are giving US exam or something. First thing you have to open the fan. Next is you have to check the ear. If you see the recoil is good, it's a term child. Recoil is bad, it's a preterm child. And next thing, you have to check the lanugo. You have to check hair. Usually, preterm child will have lots of hair, but term child will have less hair. Understood? So, lanugo is also more prominent in preterm children, but ear recoil is more prominent in term children. Understood? Lanugo is hair. Okay. First hair is called as lanugo. So, ear recoil is prominent. Prominent.